Everyone struggles with difficult emotions from time to time, but it is when those emotions begin to spiral and become difficult with that help might be beneficial. Sometimes these emotions are symptoms of a disorder, and other times they're a response to environmental, emotional, or physical distress. Regardless of the cause, it is important to seek support in these situations. Resources are available to University of Waterloo students, and this presentation outlines how to get that support. With that, let's get started. There are many valid reasons to consider seeking help, and oftentimes we don't recognize warning signs that signal the presence of an issue. The symptoms that are listed, for example, stress, anxiety, prolonged sadness, feelings of disconnection, unexplained physical pains, trauma, struggling with food or substances, becoming withdrawn or isolated, and lack of control over emotions are just a few symptoms out of many that someone struggling with mental health may experience, and they're all very valid reasons to get help. Even if you do not experience these exact symptoms, therapy can be useful for those that want to gain a fresh perspective. That being said, let's dive into some of the services that are available. Health Services houses general physicians and psychiatrists, doctors that specialize in mental health. Another resource is Counseling Services. They provide counseling, group therapy, workshops, and more. Lastly, there are student-run services which consist of many organizations that provide different types of support. Alongside this, there are a slew of crisis and emergency services both on and off campus. Now, what exactly do physicians and psychiatrists do? Both general practitioners and psychiatrists will listen to your concerns and recommend further action. This further action may consist of monitoring symptoms for an extended period, recommending lifestyle changes, referring you to counseling, or prescribing medication, to name a few. To see your psychiatrist, your general practitioner will have to refer you. The appointment with the psychiatrist is much more thorough and will possibly result in a diagnosis. In these appointments, it is recommended that you are detailed as you can be with your symptoms. To make an appointment for mental health at Health Services, call the front desk and request an appointment for mental health reasons. They won't ask you to elaborate further and will schedule you with one of the physicians that are trained to deal with mental health. The next type of support available is counseling services. There is often confusion about what counseling entails and how counselors can help with mental health, so here's a brief overview. Counselors, also known as therapists, are registered and help people handle and navigate personal, social, and psychological problems. Counselors are not doctors and cannot prescribe meds or provide a diagnosis. What they can do, however, is listen to your symptoms and thoughts and provide ways for you to navigate those issues. They may, for example, introduce you to cognitive behavioral therapy, also called CBT, which is just one of many different types of therapy. Now, to make an appointment, you'll have to make an appointment at the front desk of Needles Hall office. Here, you may be required to fill in a questionnaire. Next, you will meet with an intake counselor in Needles Hall. These intake counselors will ask you to describe your main symptoms and then book you with the counselor. For your first appointment, it is vital to be open and speak freely for your concerns. Feel free to ask for resources, concrete steps, and explicitly identify your ultimate goals. If you feel that your counselor isn't right for your needs, it is always valid to request a different counselor for your next appointment. After the first initial appointment, you can choose to follow up with your counselor, which will happen every 2 to 4 weeks, if you do choose. Now, if you're watching this during the COVID-19 pandemic, the normal protocol for booking counseling services has been changed. Now, to book an appointment, call Counseling Services to request an appointment. They're offering both phone and video calling appointments. Aside from mental health services provided by Campus Wellness, there are several student-run organizations that also support student wellness right on campus. These organizations are typically specialized in dealing with different issues. To begin with, MAIDS provides counseling to students by trained student volunteers. This is confidential and gives you a chance to talk to someone who is perhaps more understanding of the student experience. Similarly, GLOW is a queer and trans organization, which, while providing many events and resources, also offers confidential peer support. They're both provided through WUSA, and more information is available on the provided links. Like Glow, both the Women's Center and Raise are located in SLC and offer confidential support hours, among other events. The Women's Center aims to provide a female-positive atmosphere on campus, while Raise serves to address racism and xenophobia on campus. Both are provided by WUSA, and more information is available through the given links. If you require urgent support, there are many resources available both on and off campus. On campus, UW Police, Counseling Services, and Health Services provide help. UW Police is available 24/7, while both Counseling and Health Services will provide same-day appointments for any serious concerns. Here are also some hospital contacts in the Waterloo-Kitchener area. In addition to hospitals, there are many hotlines that exist to support you. All of these hotlines are available 24/7. Here's a quick overview. Here 27 provides support for mental health, substance abuse, and other crises. Here 27 will do the work of intake and booking further appointments for you if needed. Crisis Service Canada is a hotline aimed at suicide prevention and giving support to those affected by suicide. Empower Me Mental Health Resources provides in-person, phone, and video counseling sessions with trained professionals for a variety of issues. Empower Me Mental Health Resources is a great resource if there isn't an immediate crisis, as they provide help for all sorts of situations. KW Sexual Assault Support Center is not only a hotline, but also serves to facilitate healing. Lastly, the Huron Perth Helpline provides crisis phone services and focus on assessment and treatment. That covers the main resources available in Kitchener-Waterloo. Although many mental health illnesses and issues can feel incredibly isolating, you are not alone in your struggles, and I don't mean this only figuratively. The next slide contains some stats from the Canadian Mental Health Association. Around 50% of people will have or have had a mental illness by age 40. 1 in 5 people will personally experience a mental health problem in any given year. Estimates say 10 to 20% of Canadian youth are affected by mental illness or disorder, the single most disabling group of disorders worldwide. These numbers illustrate that it is not uncommon to experience difficulties with mental health. However, once depression is recognized, help can alleviate symptoms for up to 80% of people who are affected, allowing them to get back to their regular activities. Acknowledging the presence of an issue and taking the necessary steps can help you recover and improve your mental health. Remember, mental health is not an individual issue and has far-reaching effects on everyone. It indirectly affects us all. I hope that this presentation has helped clarify the mental health resources available on campus and highlighted how to engage in those resources. However, this presentation is mostly geared at students on campus and might not be well suited for students on co-op or off campus that are not able to access these resources. However, NSHLAC has created a comprehensive guide that provides more details about the resources mentioned, highlights other resources, and addresses how co-op students and students off campus can receive help. The guide is linked. Remember, your mental health matters.